My name is Dr. Grace Chingo. I'm a pediatrician by profession from Lusaka, Zambia. I am currently undergoing training under Pediatric and Medical Oncology at Dr. B. Borara Cancer Institute in Guwahati, Assam. So back home, the challenges that we have in terms of delivery of quality cancer care is that the whole of Zambia currently, we only have one trained pediatric medical oncologist to cater for the whole country. And in addition, currently there is only one established pediatric cancer unit for the whole country. In terms of the number of patients that we see in a week, there are about between 50 to 60 patients, bringing the total number of patients seen in a month to about 150 patients. And what we've noticed, the patients that come to Cancer Disease Hospital are those patients that are within the vicinity of Lusaka province, meaning the rest of Zambia are really not catered for. And in addition, most of these patients, by the time they are presenting to CDH, they are in advanced stage of the disease. As I was coming for this program, my expectations were to be exposed to the common pediatric cancer patients, be able to see patients, how they present, be able to work them up in terms of diagnostics, come up with a treatment plan, know what type of, how to approach a type of patients and what type of chemo you're supposed to give, how to administer chemo, as well as the common medical oncology procedures. In terms of apart from being exposed to how to manage these patients, I had an opportunity to be exposed to a holistic approach in terms of pediatric cancer care. Apart from having nurses, doctors on the unit, the dietitian or nutritionist is very important in terms of delivering quality care to pediatric cancer patients. Then I had also an opportunity to be exposed to the bone marrow transplant at ACTREC, which enhanced my knowledge in terms of how complicated cancer patients are managed, as well as as you are planning for the treatment of a patient, I was able to know what approach I should do in terms of planning the initial management of the patient. In terms of the training, the COVID-19 pandemic affected the time that we spent in doctor-patient interaction, as well as the time that we interact with the residents here, as well as the consultants. But despite all this, we're able to continue learning and interacting with our colleagues, the residents, as well as the consultants through webinars and Zoom presentation. So my advice to would-be trainees, those who would like to pursue a training in pediatric medical oncology, is that because the training duration is short, it's just 1 year, the minute you land, you run and spend more time interacting with the patients on the ward, interact with the residents, be proactive, have a schedule of things that you want to learn. And whenever you're not clear, always approach your consultants. They are very approachable. Currently, back home in Zambia, there are no other organizations that are offering a similar training program for pediatric medical oncology. In terms of suggestions on how to improve the program, what I noticed is we had a challenge with, in terms of language. We're not able to interact with the patients without a translator. So I would recommend that some sort of language training is given to trainees. For instance, maybe the first 4 months or so, on the common words that are needed for you to make your training more smoother. In terms of how the program can be improved, I would recommend that Since most of the locals, meaning the patients, speak the local language, it would be helpful if the trainees are exposed to language learning concurrently with the training for at least the first 4 weeks. In addition, there should be some form of guidance, some form of guideline for the trainees in what they should focus on, the important aspects of their learning. Because oncology is quite wide, and without proper guidance, without a proper laid down syllabus for the training, we wouldn't know really what to concentrate on in terms of our training. Then in addition, we would request that the residents as well as the consultants should use the English language as much as possible during the teaching sessions and not use their local language. Critical things that can help improve the cancer care back home in Zambia are: 1, strengthening of cancer control programs, because most of these patients that we receive come in advanced stage, and what we've noticed is for some of these patients they're either undiagnosed or misdiagnosed. Then the other issue is in terms of human resource. We have very few specialists available in the country. I would like to thank Merck Foundation and Tata Memorial Center, specifically Dr. B. Borao Cancer Institute, for according us this opportunity to have exposure, acquire knowledge and skills to be better equipped to deliver specialist cancer care back home in Zambia. We are definite that the exposure that we've had will have a lasting impact in terms of delivering better quality health care services for pediatric cancer patients in Lusaka, Zambia.